The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum. Assalamu alaikum and welcome to Health and Fitness Show. Assalamu alaikum to all listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all had a nice and positive week so far, and looking forward for a nice and relaxing weekend. This program is broadcasting live from the studios of Inspire FM today on 12th of September 2019. The time is now just past 6 o'clock. And this program is casting its positive vibes to all our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpenden, Bedford, and definitely our positive airways also reaching to all the listeners who are listening us using Inspire FM app or website. You can view us via Facebook. So all you have to do is go to Inspire FM Facebook page and click our live link. Unless you're listening this show on Sunday or any other Thursday other than 12th of September 2019, that means it's a repeat. As we all know that we cover different health information related topic every single week, and definitely today is pretty much same kind of thing which we will be doing today, and we will be looking towards some information from a different vantage point. As we all know that our children have gone back to school and they are pretty much settled in the schools, but definitely as the winters are on its doorstep, although we do have a bit kind of a nice lovely hot days, a couple of more hot days coming towards our way, as I heard, but yeah, the weather in this country is pretty unpredictable and it changes quite a bit, and whenever the weather change, one of the problems come in play is that if the children have any long-term conditions, when I say long-term condition, that means any conditions which is pretty much lifelong, like asthma or like any other symptoms, not children, adults as well. So these weathers affect big time, especially when kids have asthma. So I know you might be thinking, okay, I'm reaching towards my topic. Yes, indeed, I am reaching towards my topic. My topic for today is childhood asthma. Yes, indeed. We will be talking about childhood asthma, and we will be finding out how we can safeguard our kids from having any unwanted hospital trips, and how we can successfully manage their conditions and make sure that they do not miss their schools, because these things are very important, and especially nowadays in schools, our kids, they've been immensely under pressure with all the education stuff and everything, and definitely we do not, and I mean it, we do not want them to miss a single day of school. So definitely we will be catching on that. But hey ho, I'm not the one who will be talking about this. I'm the one who's presenting, and luckily we have a lovely guest with us today. So on this note, let me introduce our guest for the evening. We will be joined by two guests today, as usual. Our first guest is very new to this show. She is an asthma nurse, children asthma nurse, and her name is Colette Seddon. Good evening, Colette.
Good evening.
And shortly will be joining us our very own residential doctor, Dr. Talib Bakr. He's the respiratory lead for Luton CCG, and he will be also adding his information on the topic of asthma in the journal as well as the childhood asthma as well. But luckily, most of the childhood asthma will be covered by our very special childhood nurse. But let's go to our guest and let ask them to introduce about themselves. Dr. Abu Bakr will be joining us very shortly. But till that time, let's ask Colette to introduce herself. Colette.
So my name's Colette, and I'm the children's respiratory lead in the community, and I'm also an asthma nurse specialist, and I look after children with asthma in the Luton area, and that's it really. Help support them, help manage their symptoms, help them empower themselves to know what to do in a situation of wheeze so that they can potentially avoid having to go to hospital.
Indeed, and definitely we do not want our kids to end up in hospital in any way, shape or form for any such reasons, because, well, trip to hospital is not very pleasant, isn't it, Colette?
No, it's not a pleasant experience.
Exactly.
And we can do things that aren't nice to children, and they become very scared and very anxious, and we don't want children to grow up in fear of a nurse's uniform.
Yes, indeed. Although you do give stickers to the kids.
We do give stickers, yeah, and occasionally we'll blow bubbles, but...
Definitely. I love that part. I love the fun part, but not the other part, definitely. On this note, let me involve our listeners as well. So, listeners... if you have any questions or queries regarding our show tonight, please give us a call on 01582 481822. I repeat, 01582 481822. You can send your questions via text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. It's not if you have experienced or if your kids are having some problems with asthma, you can also call us or share your experience as a parent, as in how daunting it is or how easy it is, or what kind of necessary self checks you have put in place. Definitely your comments are always welcome, but yeah, please do get in touch. So let's start our show. Hopefully Dr. Bakr will be joining us very shortly. So Colette, now the biggest question is, what is asthma?
So asthma is a chronic respiratory disease that involves the airways become narrow and they can spasm, and its symptoms tend to include coughing, especially nighttime coughing, chest tightness, shortness of breath, and a wheeze. Doesn't mean that you will get all of those symptoms. You may only get one. You may get two. You may be unlucky and have all four. But that's basically what asthma is. And it's a long-term condition. There is no cure for asthma.
So when we talk about asthma, and especially kids' asthma, how a kid's asthma is different than an adult asthma?
No, not really.
Okay.
No, it's the same same thing. They think what they do say is with adults, it's mainly allergy or work related, and that children may not have allergic asthma so much. That doesn't mean that they won't, but as they get older, their triggers will include allergies as well.
So when the asthma types are not very much different, is the treatment type different?
The treatment's the same, as in it's a preventative inhaler, which is an inhaled corticosteroid. The only difference is for adults, there are different inhalers available and different medications that we are unable to prescribe for children, as they're not licensed for use in children.
So because we are talking about asthma in kids, so what sort of treatments we normally offer to
We would start them on a preventative inhaler to start with, normally something called clenil modulite, which is our first line treatment. And we would try them on that to see whether symptoms improve. Something we have started in the Luton area is an asthma trial. Because there is no definitive test to diagnose asthma, it's good history taking and looking at all the symptoms that they're presenting and have they got clear triggers, such as if they come into contact with cold weather, does that cause them to get wheezy or start coughing? And once we've got a good history, we'll start them on an asthma trial. So we will give them a preventative inhaler for 8 weeks. After 8 weeks, we ask them to stop for 4 weeks. If any of those symptoms come back in those 4 weeks, that's a good indication that you are asthmatic, and then we would continue treatment.
So how it's good? Sorry, I missed it. So how come it's a good indication that it's asthma?
Because the symptoms stopped while they were taking that preventative medication, and when they stopped the medication, the symptoms returned.
So if symptoms don't stop after they stop the medication, while they're taking the medication, so that means...
It means it could be another respiratory disorder, and that would be more to refer back to the GP.
And as soon as you mentioned GP's here. Sorry, carry on, please.
Okay. So we'd refer to the GP. A GP may then decide that perhaps a more in-depth assessment is required and refer to a paediatrician at the hospital.
Okay, perfect. On this note, let me introduce our GP as well. Assalamu alaikum, Dr. Ab.
Walaikum salam.
How are you,
Sorry,
sir?
I'm late.
No problem.
Just dealing with asthma. Honestly, my last patient.
Perfect. So, Dr. Bakr, a residential doctor, everybody knows him. Everybody loves him. I love him. Good evening, Doc.
Evening.
Quick intro and then tell us about asthma.
I'm a GP in Luton, in Bury Park, Bell House Medical Centre. Been there for a long time. I'm also the respiratory lead for adults, not children, but obviously as a GP I deal with a lot of asthmatics and get a lot of guidance from specialist nurses, because the nurses often are more specialised and know a lot more than we do.
Definitely. In terms of, I've just asked Colette about asthma, what's the difference between children asthma and adult asthma, and then we were talking about treatment, and then Colette mentioned that we give them a 4 weeks 8 weeks, apologies, 8-week treatment, and during the treatment, if the symptoms goes away, that means it's a very likely chance of being asthma. So I've asked if it doesn't go away, so she mentioned that it might be other respiratory disease, and she refers to the GPs. So when you got these kind of referrals, what is most likely it can be?
Well, the beauty of with seeing the nurses first is it's not just about the medication, it's about how they use it, whether they're using it correctly and things like that, which they go through quite thoroughly. Your local pharmacist can show you how to use it as well if you're not sure. If it's not asthma, there's lots of other causes, chronic infection, TB, things like bronchiolitis, cystic fibrosis. These are all really rare things. Most of the time it's asthma in children who present with wheeziness and shortness of breath. So I could get really complicated and go through lots of other causes. We ourselves will look and might do a chest x-ray, may organise some blood tests, but invariably we end up sending to hospital for more specific tests, like scans and things. But the majority of kids with shortness of breath or chronic cough tend to be asthma. Occasionally we get postnasal drips where they get chronic rhinitis, which sometimes can be linked with that asthma, eczema. Or they sometimes get reflux, which is acid coming up, which can give them a bit of a cough, tickly cough. They may have accidentally swallowed something, or you know what kids are like. My kids, a nightmare sometimes. They put things in their nose and things like that, which then can cause them to be short of breath. They might have swallowed something. They shouldn't have. Tiny kids shouldn't be having things like peanuts and things, because they can accidentally swallow it and go into the lungs. They normally become acutely breathless, so it's a lot more breathless than what we would see with mild asthma.
Okay, let's introduce our listeners as well. Listeners, if you have any questions, queries, or comments, or if you have experience as a kid, or your kid experienced any kind of asthmatic episodes, please do get in touch with us and share your experience. Or if you have any questions, we have plenty of clinical expertise in the studios. We have an asthma specialist nurse, and we have a community nurse, and we have our GP with us and sharing this knowledge with us. So please get in touch with us by calling us on 01582 481822, or you can send your questions by text messages or WhatsApp on 07779 481822, or you can send your question online by typing it on the Facebook page. So in terms of when we talk about kids, now kids is a very large bracket we can so it starts from day 0 till age of 18. So how much likely which bracket is more likely to get affected at what time?
We would be reluctant to diagnose asthma in a child under the age of 4 unless there's a strong family history of asthma. So from the age of 4 to 16 to 18, I see in the community. From then, they're either discharged or transferred to adult services, depending on their needs.
Okay, so in terms of anybody who's less than 4, what are the symptoms which push them towards the line of being asthmatic?
It's difficult because they could have childhood wheeze, and the childhood wheeze can be treated the same way as asthma, but they grow out of it. Asthma you don't grow out of. So unless, like I said, unless there is a strong family history of asthma in the family, it'd be difficult to diagnose before the age of 4.
Okay, so in terms of when we talk about things like wheeziness, especially when the winter comes in play. Now, commonly, if the people who are not very much in control or not taking necessary preventers at the right time, what kind of a flare up it can happen?
It could be life-threatening if they're not taking their medication correctly. They could have the cold weather could be a trigger. So everybody's asthma is different, and everybody will present differently as well. And everybody has their own set of triggers, and it's recognising and understanding your own triggers and knowing how to avoid and what to do if you do come into contact.
So, for example,
cold weather. If in the cold weather, we would recommend that you loosely wrap a scarf around your mouth and nose before you go outside to trap that warm air, and that can stop you having an exacerbation.
And if they end up in your clinic, sir, what do you do?
So often it's kids who aren't using their inhalers. So we make sure that they're using, particularly their preventer inhalers. Because what you've got to remember is the airways are getting tight. But what makes them go tight is the muscles of the medium-sized airways that go tight. But what causes them to go tight is what we call inflammation. You know, when you get an infection, you get lots of red cells and things like that, so everything looks red and what we call inflamed. Well, what most people, the mistake they make is they use their blue inhaler. Everyone's seen Ventolin, salbutamol. That opens up the airway, so people think, oh, that's working because it works very quickly. But what they don't realise is the inflammation that causes the muscles to go tight. That's what the preventers try and stop being released. So what most people do is they use their blue inhaler, feel good, so they don't think, oh, I don't want to use a preventer. Because when you use a preventer straight away, it often doesn't make any difference. And I'm sure Colette would agree with me, that's often the biggest thing that we try to constantly remind people, yes, your asthma's controlled, but it's being controlled by the preventer. So keep using the preventer until time has it that you haven't needed a blue inhaler for a long time, and I often say 3 to 6 months. And if you haven't, that's when you would think about coming off the brown inhaler. But I'm sure all the kids you see, Colette, same as me, is when they haven't, what we call an exacerbation, when their asthma gets poorly, is often when they've not used their preventer.
And I have to say, teenagers are the worst for that one.
Yeah.
Indeed.
And parents worry because they know some of the preventers are steroids, so they hear the word steroid and get really freaked out about it and think, that's dangerous.
Fit. Yeah.
You know,
Fat.
either fat or it stops their growth, all sorts of things that we hear, but they're tiny, tiny doses. And, you know, it stops the inflammation. And the problem with inflammation is if you don't stop the inflammation, you start to get scarring. And if you get scarring over a long period of time, unfortunately we don't see it often nowadays, but if you look at some of my elderly patients who didn't have asthma inhalers when they were younger because they didn't exist, they had bad asthma that wasn't controlled. Now they've got bad lungs in adulthood because they've got scarring and their lungs aren't flexible. So that's what we're trying to prevent. Now, you know, there's winter times and times of cold and things, that's you're likely to get coughs and colds. It's knowing what to do about that. It's how you build up your immune system and don't destroy your immune system by things we've always talked about. That's healthy eating. And teenagers don't smoke, and the number of kids that are smoking is the biggest number.
Exactly.
It's huge. You know, you've got, you know, it amazes me how many people have inhaler one hand and cigarette in the other. It just doesn't make sense.
No, I absolutely agree with you. And on the other day, I just saw a few kids who are like hardly 12, 13 maximum. They were having smoke. I was a bit kind of confused in many different ways. How can they get their hands on cigarettes? But anyhow, and yes, correctly, they might have asthma in one hand. There are so many adults I've come across who are in that situation. So when we talk about good control, so in terms of kids, as you have mentioned earlier, Doc, that inhaling technique is very, very important. And so what kind of challenges, Colette, you see in the community clinics?
With younger children, it's normally fine because the parents are on board and they're happy to use the correct spacer and medication. Please, can I just stress, it's not about technique. If you are 5 or 55 and you have a metered dose inhaler, you need a spacer. So teenagers, you see them spraying it directly into their mouth. Might as well spray it at the wall pretty much for all the good that it's doing. So it's really important to get that message across that it's not just about taking it, it's taking it correctly and using everything in place to get that medicine where it needs to go. So with teenagers, we can try them on dry powdered inhalers where they don't need a spacer, but that does take a good technique to do as well. And I think what I have, which I would, I think he will agree, that I have that luxury of time to sit with my patients. I can spend an hour with them. And obviously I know that GPs do not have that luxury. They're under a great deal of pressure to see lots of patients. So I have that luxury of being able to really sit down and try and convince them that it's the right thing to do and that we want them to stay healthy. We want them to stay out of hospital.
So in terms of the good control, what do you call a good control?
Not needing salbutamol, not requiring any hospital admissions, not requiring any further steroids like prednisolone, and having a good asthma control test at each review.
And what does those tests?
The asthma control test is just a series of 5 questions asking about the last 4 weeks. Has it impacted on your activity of daily living? Have you had any wheeze? Have you had any shortness of breath? Have you woken up at night with any of those symptoms? And the last one is what they actually think their asthma control is. So there's no right or wrong answer, but it's a series of questions that ideally should be done every time you have contact with the patient.
Definitely. And in terms of those annual reviews and where we test patients with I completely forgot about that test where you put them.
Peak flows.
Thank you so much. I was thinking. So How that fit in? Is that just an annual one, or do you do?
I do peak flows every time I see my patients. So the peak flow is based on their height in children. So you'll know whether they're hitting the right amount of air forcing out their lungs that they can, and it's then making the parents aware that actually if they can't blow this, say their best peak flow is 200, they can only blow 100, and salbutamol isn't helping, then you know that it's an indication that something's not going as it should be.
Definitely. Okay. And on that note, I must say, wow, the time has passed really, really quickly. I do have a couple of more questions on that because it's almost time for a break. So when we come back from break, we have a doctor and a nurse with us who will be talking about asthma, and we will ask them how often we want our kids to go to a doctor or a nurse for an asthma check, how much important it is, what sort of control they need, why do an emergency they need to see, and definitely importance of flu vaccination. So this and many more, it's coming back after these very short messages.
You're listening to an Inspire FM podcast, making available our popular programs from our daily broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. I welcome you all to another exciting and educating edition of Health and Fitness Show after break. I'm Fahad Matin, your host for this evening, and we are talking about childhood asthma. With our lovely guest in the studio, we are with Colette, Seddon and Dr. Talib Bakr. Good evening.
Evening.
Good evening.
This program is broadcasting live today on 12th of September 2019 from the studios of Inspire FM for our lovely people in Luton and the surrounding areas of Luton, like Dunstable Harp and Bedford, and definitely all our listeners who are listening us either through our app or through if you're listening through us on Inspire FM app or website, or you can also viewing us from our Facebook page. So welcome. Before we went on break, we were talking about some of the good controls, and we mentioned about peak flow and peak flow measure, and Colette was so nicely explaining about it. I do have a couple of questions on that regard, but at that time the ad break just hit in. But definitely we will going back on that topic. But let me introduce our listeners as well. Listeners, if you have any questions or queries regarding our show tonight, please give us a call on 01582 481822. I repeat, 01582 481822. You can send questions via text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. Or you can send your question via a WhatsApp app, on Facebook app as well, which is the live link. So, Colette, before when we went on break, we were talking about peak flow measures, and you mentioned that every single child should have a peak, and you make sure that they do whenever they come to see you. Do you make sure that they know what their peak flows is and what are the good ones and the what bad ones?
It is again about technique. So we have to look at how they are blowing. So once we've got that measured and we've got a good technique, they will eventually get an asthma plan, which will tell them what to do if their peak flow is 50% less than their best blow.
Mm-hmm. So how do one remember what is the 50%?
It will be on their plan. It will say if your peak flow goes below, then this is what you need to do.
Okay. So in terms of kids, or when we come to kids, normally rule of thumbs does help a lot. So rule of thumb regarding the asthma is you need to have your preventer,
to take that as prescribed, and it's normally 2 puffs in the morning, 2 puffs in the evening via a spacer. Can I please also point out, do that before you brush your teeth. It's important to rinse your mouth out with water or brush your teeth after having a preventer inhaler. It can cause thrush, which is very unpleasant and very uncomfortable.
I did not know that. Okay, that's a good thing to know. Please carry on. So need to have preventer twice, 2 puffs twice daily.
Yeah, with your spacer.
With your spacer.
And a peak flow meter, and that's what you need to have with you. Peak flow meter, I wouldn't expect people to carry that around with them all day, but they should definitely have their salbutamol and their spacer with them at all times in case of an emergency.
And salbutamol is the one
the blue inhaler,
which you carry on.
Which is your reliever.
Which is the reliever, and you can only use it at the time of dire need.
Well, sometimes it will be part of their treatment plan. If they have problems with exercise, we would recommend that they have 2 puffs of the salbutamol before taking part, just to get those airways open, so to hopefully that they will be able to continue with a full PE lesson or whatever activity they're doing, because exercise is so beneficial for asthma, and it's really important that children do participate in PE at school and other activities.
So when we talk about other activities, what is a good symptom for kids or even for teachers to know that child might need an asthma inhaler?
So they might be coughing a lot. There may be an audible wheeze. They may be able to hear that. The child may complain of their chest feels tight. In younger children, they may not be able to verbalise that, and you may see them pushing on their chest. But they will look terrified. They will look like a rabbit caught in headlights. In older children, you might find them leaning forward, and they start what they call tripoding, where they're going up and down. They're trying to get air moving around their body, but that's the last sign of somebody having an exacerbation of asthma, a severe life-threatening. Potentially life-threatening. So
at that stage, what do we need to do?
Sit them up, loosen their clothes, give 10 puffs of salbutamol correctly, call for an ambulance.
So, Doc, now when we talk about emergencies and so forth, in general, what do we class journal as an emergency? Especially when we talk about asthma.
Well, all asthma that's not controlled is potentially could be an emergency. So again, I keep repeating this, but this is what we keep seeing is people aren't using their preventer. They think everything's okay, so they stop their preventer. They've been okay for a week, and they stop their preventer. It's the preventer that's going to prevent them.
Which is the brown inhaler.
Which is either the brown inhaler. There are others. So if the preventer that you're on and you're still needing your blue inhaler, so I wouldn't say it's just for dire emergencies. If you find your chest is tight, if you find you're a bit wheezy, you're more short of breath than normal, things that would normally you wouldn't think about doing but suddenly start to become a bit harder because you're getting breathless with it, you need to use your blue inhaler. But if you're finding you're using your blue inhaler more often, then that means you're not on the correct treatment, i.e. you're not on the correct preventer. So we may need to up what we call the whole way the British Thoracic Society and the guidelines, NICE guidelines, talk about asthma is like a step-up ladder. You go up the ladder. Once you're controlled, you can step back down. What we don't want is people to step up and step down by themselves. They need to be guided through that. So when you talk about emergencies, it's knowing what to do when you start to feel short of breath. So when it's a little bit short of breath, you've got a slight cold or something like that, then we ask people to increase their blue inhaler, the reliever. And you can go right up to 2 to 4 puffs. When it's a bit worse than that, then you can go right up to 10 puffs. If you're needing 10 puffs, you probably need to be assessed by a clinician of some sort.
Okay, so that perfectly lead me to my next obvious question: that how often a person with asthma diagnosis should visit a GP for their asthma check, kids or adults?
Well, if we've got it right, once a year, because that means they're perfectly controlled. They're carrying on with their normal day-to-day activities. They're getting in for children. They're getting involved with sports, and they don't have any problems. So we recommend once a year because it's good to recheck their technique, whether we can step down their treatment, because if they're so well controlled, maybe we can step down and go through things again, because you need constant reminding. And we all get into bad habits. We start cheating with the inhalers, or we forget to shake it before we use it, and all sorts of funny things happen, and it never ceases to amaze me how many different ways people use their inhalers. So having that yearly check just to make sure that you're on the correct dosage, to make sure that you don't need to go up the ladder or down the ladder depending on that. So it's always worthwhile, and we're constantly writing to people to have their asthma reviewed, but a lot of people don't attend for that. So that's the control side. Now, if you're not controlled, then you're going to be seeing us more often until we get that control. And if we can't get that control either with Colette's help or ourselves in the community, then that's when we need secondary care. And the guidance is really, if you're using that blue inhaler more than 3 times a week, then you're really not at that right step. You need to be moved up the step ladder. And that's where we struggle, because people carry on using their blue inhaler thinking that it's working, yet they're using it 3 or 4 times every day. Well, the guidelines suggest 3 or 4 times a week. You're not at the right step. Now, very rarely there are groups of people that we can't control in community. That's where they need specialist care, specialist treatment with all sorts of allergies and things like that. But it's very simple steps that we're told about in community.
So that perfectly moved me towards you, Colette. In terms of community, what sort of community support available for kids all of a sudden who have any kind of asthma problem middle of the night? Do they need to call 999 or 111, or do they need to take it to the hospital, or do they need to call you guys?
Well, it wouldn't be the community in the middle of the night. We're in bed at that time. It's basically knowing your child's symptoms and knowing what to do. And if what you do doesn't help or relieve, where do you go from there? Call an ambulance or drive. I would be more inclined to call an ambulance if it's the middle of the night and they're having difficulty breathing. I would be much happier for a paramedic or an ambulance technician to come assess the child, and if they felt happy that yes, they need to be seen, but you can go there under your own esteem, then that's great. But I just feel, especially if your child's having difficulty in breathing and you're driving, you're going to be panicking yourself, and that's potentially unsafe for a lot of people. So.
And in terms of the community support now, in terms of your help towards general people, how does this come in play?
I get a lot of referrals from my school nurse colleagues. We have a lot of children that are out of school, and asthma is their reason for not attending. They will ask me to come and see and assess them. Sometimes I'm asked by GPs as well to they feel that the children might need additional support. I also get referrals from consultants at the hospital and children that have attended A&E, especially children that they've seen come in a few times and potentially haven't gone to their GP to seek further help.
And also from 111 as well?
I don't get referrals from 111, no.
Okay. So in terms of the when we talk about asthma and when we talk about children's, it's a common perception that if we have a good control of asthma throughout the childhood, it is quite possibly that the child might grow out of and they may get cure from asthma. Is that true, or is it just a myth to both of you?
I think it does depend on how damaged the lungs are. If the lungs have become, if it's been left untreated for 6 months, a year, then that could cause permanent scarring, as has already been said. So, I think it's a debate. Do they grow out of it or don't? I feel that they potentially don't. However, from a GP...
Well, I had asthma as a child, but I don't use my inhalers now. Not needed to use it.
And you run marathons now?
But I always know that something might trigger it off, so I need access to inhalers. I need to be aware of when I'm breathless. Is it an asthma attack coming? So you don't want to be complacent about it. So there are people who will not have asthma. We used to do the medicals for the Royal Navy and Royal Air Force, and if you've had asthma up until the age 15, you had to be much more stringent in passing people. They had to have no inhalers for a number of years before they would even contemplate, because the last thing they want in the Navy is you're in a smoky environment, the ship's got smoke everywhere, and then your fellow colleagues have to look after you because you're having an asthma attack. So technically, yes, there's no cure in the sense that I can't give you medication to stop you ever having asthma, but you can certainly get better control and stop some of the triggers. So if you know certain things, we touched on what asthma is, but there's a lot of evidence now it's an inflammatory condition, and in the Western world, inflammatory conditions are growing. So inflammatory conditions such as asthma, eczema, psoriasis, ulcerative colitis, Crohn's disease, heart disease, strokes, diabetes are all being linked now to inflammatory conditions. And that's been linked with the bad food we eat, the bad lifestyles we lead, the lack of exercise, too much sweets, too much sweet stuff, too much E-numbers, all tend to aggravate your immune system to overreact. So some people think the immune system is a bit like your car alarm. If you keep triggering it off, it triggers off too quickly. So the whole purpose of the immune system is to defend you. Now, if you keep abusing it by doing the wrong things, then it will trigger off too quickly. So people then say, well, what about kids? What of that? They don't drink, they don't smoke. Well, actually, some do. They need to stop. But it's the foods we give them. I'm just as guilty as the next, stuffing my kids with sweets and stuff like that, which immune system, too much sugar poisons the immune system. The immune system's your bodyguard, it's your army that's there to fix things. Well, if you don't feed your army properly, it doesn't work properly.
And everything need to be in moderation and equality.
Yes.
Okay.
Except smoking. Smoking should never be in moderation.
Definitely, it needs to be stopped as soon as possible. One of the things, as we are moving towards cold weather, so common things is the allergies which tends to trigger, especially with the cold weather, and if we are moving towards summer. It's the pollens and all the other things. So when we talk about allergies, the first thing, especially when we are talking about allergies in the cold weather, first thing comes in play is the flu vaccinations. Now, I wanted to know both things. So let's talk about allergies first. What sort of other allergies sometimes trigger asthma?
Animal hair, pollen, food allergy, molds. It could be anything that, there's no definitive list. Anything that you could potentially be allergic to could potentially cause you to have wheezy episodes and an exacerbation of asthma.
Most people will know. When you're very young, of course, you don't know. So keep a diary of times when you've had it. See what you were doing the day before, during the day. Is it certain rooms? Is it certain people's houses? Is it certain pets? These sort of things trigger off. We get involved with the allergies when we feel that the first 2-3 steps of asthma don't control it. Then that's when we think is an allergic element to it. So things like dust mite and things like that, they get tested for in hospital. But at the end of the day, the treatment's the same. So a lot of people, when they first get diagnosed with asthma, think, why aren't we being referred to hospital? But most of the things we can control with the first 2-3 steps. It's when that isn't controlling things, that's when we would need to think these people need more specialist care. For most asthmatics, there isn't an allergic component to it. It's what we call atopic. Their immune system's too reactive. So things like runny noses, things like eczema, things like asthma run hand in hand because their body's immune system reacts too quickly. And it often runs in families. So that's clues that we have, whether if someone's a little bit short of breath and we're not quite sure, they've got this tickly cough that keeps dragging on and coming back, dragging on. We often ask about a family history, and invariably we find someone's been suffering from eczema or asthma somewhere in the family. And we would then tend to treat them a little bit quicker in terms of asthma control.
Okay. When we talk about flu vaccines, how important is flu vaccines?
I feel it's very important to protect yourself against, because upper respiratory infections are big causes of causing problems with asthma. So to protect yourself and to protect your family, I really do advocate having flu immunisation.
Because in Luton, we in schools especially, the public health clinic is doing a big pilot project on 6 public schools and 3 private schools, so that makes 9 schools altogether, regarding the flu vaccines. And now one of the problem we see is the children in school-going age, they normally don't have flu vaccines, which is alhamdulillah, we got it for free because of pork gelatin. So they're running a project where the kids in those 9 schools will be given flu injections which do not have a flu vaccine. So if your child is going to school, do double check with the principals or the family workers that if the flu vaccines which will be given to them has or has not have pork gelatin, definitely, but that should not be stopping you to have vaccines, because definitely that is one of the most important things, isn't it, Doc?
Yeah, I mean, we talk about immune systems. If your immune system's busy fighting off infections, it's more likely to trigger off your asthma attack. And then while your immune system's busy looking after the virus, you can get bacteria, things like pneumonia and things like that. And your ability to fight these infections is harder if you're being attacked by flu viruses. So anyone who's on a preventer, particularly children, should have their vaccinations done. The pickup for Luton's very poor, and there's always this debate about pork and gelatine and so forth, but unfortunately that injections don't have pork, but kids don't like injections. And I'm not a scholar, I have to be guided, but my understanding is that if there is more harm done, you're allowed, but that you have to verify with your own scholars and your own beliefs. But you don't want your child to be in hospital with a severe asthma attack because they've not been vaccinated against flu.
And while we're on the topic of flu, what are the ages which definitely, if you're asthmatic, need to have flu vaccines?
Any age. If you're asthmatic and you're on a preventative medication, then I would encourage you to have the flu immunisation.
And in terms of if you're not on any medication, like you said, if with better control, if you are not taking or stepping down from the preventive, do you still need to take flu vaccines?
I think it would be advisable just to give you that added protection.
Good. And on that note, I must say we are really coming close to end of the show today. We just have a few minutes remaining in our hand, so let's do a quick round of catch up and positive messages from both of you, from both of our guests. So let's start with you, Colette.
So if you do have any concerns about your child's asthma and you live in Luton and you'd like some more support and advice and management guidance, please speak to your school nurse or GP, who will be able to put you in touch with me, and I will come and see you and we can sit down and go through things.
And you have a whole team of persons, not just yourself.
Yes.
Definitely. And any positive message for people?
Asthma, if you control it, just Google Laura Kenny. She's a 4-time gold Olympic medalist, and she has difficult asthma apparently. So it doesn't stop you from doing things. Control your asthma. Don't let asthma control you.
Perfect. Doc?
If your asthma's not controlled, seek help. And for families, is knowing what to look for if their child's asthma is not well controlled. And I can't stress enough, make sure you're on your preventer. Don't stop it on your own accord. You seek help from your practice nurse, from your community nurse, from your doctor on what they should be doing. And use the Asthma UK website. It's absolutely fantastic. It's got lots of resources, lots of things to reinforce some of the messages that your healthcare workers might be giving you. It's got videos on how to use the different types of inhalers. It gives you an idea of what inhalers you should be on, what to look out for when you're feeling poorly. So lots of information, and get your management plan from your nurses, from your practices. You should be able to know the written plan on what to do when you're not feeling well with your asthma. So that's national guidelines is one of the things that we do badly in, is not people having using too much of their Ventolin without having preventers, and B, not having management plans on what to do when you have an exacerbation.
Definitely, and that is most important thing, and you have to make sure that everything is in place. So thank you so much, and unfortunately that's all time we have. Thank you so much for Dr. Bakr, and thank you so much, Colette, for coming in today and sharing this wise wisdom from with our all lovely people in Luton. And guys, that's all for today. If you have missed any part of the show, please don't worry. You can catch it, the whole thing, on Facebook, Inspire FM Facebook page, or from our online link. Or otherwise, you can listen on Sunday. Till next week. Assalamu alaikum.
Thank you for listening to our podcast. Why not tune in to our live stream at inspirefm.org and follow and subscribe to our social media platforms at Inspire FM Luton.